Hello, Dallas. It's time to wake up and get wealthy. I'm Terry Ahrens, Wellness Director with the Aaron Family JCC, and February is Heart Awareness Month. And we are here today with Dr. O'Brien, and between the two of us, we are going to discuss on how to live a healthy heart lifestyle. Thank you so much for coming on.
Absolutely. Thank you for having me. I'm really delighted to be here.
Well, we really appreciate you taking time out of your day and out of your clinic to be here. So go ahead and just explain a little bit, share with our viewers just who you are and a little bit about your clinic.
Perfect. I have been in the world of functional medicine for about 20 years. My goal is with patients to always get to the root cause of why they're having some type of illness or dysfunction. Rather than band-aiding things, we look for, to the best of our ability, the cause of what's happening with them. So my wellness center is in Louisville, and we see patients for hormone health, cardiovascular health, chiropractic care, acupuncture, massage, posture therapy, etc. It's a whole lot of fun. I know, right?
Right. Yeah. Well, I love that. And like your wellness clinic, it just sounds like it has so many offerings. It sounds like I was checking the box. That one. I need to come visit.
Yeah, that would be lovely.
Yeah. Well, as you know, this is February, and it's also a big Heart Awareness Month. And I thought it'd be really fun for us just to talk a little bit about, various ways to develop heart healthy habits. And so anyways, if you wouldn't mind just starting the conversation with just simple, when folks come to your clinic, what are just some easy tips that you have for cardiovascular heart healthy awareness?
Yeah, that's a great question. So, everything that we do really depends on the person. We don't ever cookie cutter anything. So we always want to focus on.
I love that.
Yeah, it's really important. I've learned over time, everybody is different, and you have to meet them where they are in order to have the most success. So regular cardiovascular activity, whatever that looks like for that person, around 150 minutes a week, ideally.
150. Okay.
And it can be broken up.
Could pickleball be included in that?
Yes, pickleball. Yes, pickleball. The sport that is, sweeping the nation and the world, really.
Yes.
Absolutely, pickleball is included in that. And then including at least a couple of days a week for strength training to build stronger muscle, to build better bones, and just to not only maintain their current health, but hopefully improve their health.
Well, I'm so glad that you put together there like a little fusion thing going on that, yes, strength training, and it has so many benefits, but so does, I feel like all of a sudden strength training is like the modality that everybody's pushing in the industry, in our fitness industry and wellness industry. But I'm glad to see that you're also mentioning that cardiovascularity and cardio activities are also still really, really important to create the whole you and to meet people where they are.
Absolutely. Yeah. Cardiovascular activity and it doesn't need to be, high intensity interval training. I usually don't even recommend that for most people.
Okay.
Just getting started out, walking is perfectly fine. Just getting outside and moving.
Yes. And I heard walking, you just got a new puppy, right?
Yes, yes.
Yeah. So, even just something as simple as that, would you also include like housework? Consider that like cardiovascular. I mean, your heart rate does get up. So vacuuming and even cleaning up and all of that.
Movement,
those types of
activities in general is what we try to encourage, especially if you can. Getting that type of movement outside in the first morning light, in those first even 10 minutes of light during the day, really help to improve overall health, but also mental health in general.
Okay, so you're taking in the light perspective. So let's do a little deeper dive.
Yeah,
how does this relate to the wellness perspective?
Of course, yeah. So I think a lot of us, possibly most of us, have fallen into a habit of grabbing our phones first thing when we wake up and exposing our bodies to blue light first thing in the morning. And that's the last thing that we want to do. for overall health and sleep hygiene in general. And exposing your body to full spectrum light first thing in the morning has astounding cardiovascular and overall health benefits. It helps to get better sleep at night, even though we're not thinking about our morning activity as being involved in our sleep routine or our sleep cycle and how deeply we sleep. But it really does make a big difference if we can get that full spectrum light on our eyes when we first wake up. It can change our health dramatically.
Wow, full spectrum light on the eyes when you wake up, first thing in the morning, no phones. Remember that, folks. That's like a really important keynote there.
The other thing to add to that is if you are a coffee drinker or caffeine drinker, put that first cup of coffee consumption off for 60 to 120 minutes if you can. Because not only does caffeine affect your cortisol, which is your stress hormone, but also adenosine. And if you can delay that coffee or caffeine consumption 120 minutes, it can improve your overall health as well and give you even better sleep at night.
Oh, wow. So even delaying it in the morning will give us better sleep at night. That's amazing. That is such great information.
And then if you can substitute, a little bit of breakfast first thing in the morning, you're then improving your overall metabolic health.
Yeah, I'm a true believer that a little bit of eating something in the morning is so key. It's like having a fireplace and you got to put the logs in the fireplace. That's your metabolism is the fireplace. So you got to keep fueling that metabolism in order to have a successful day.
Absolutely. There's a lot of, there's a really big trend, I think, still for intermittent fasting and not eating until 12 or 1. And the most current research, thankfully, is finally being done in women in general. But being done, we could see that overall intermittent fasting is really harmful for hormones, for sex hormones and adrenal hormones. And we see lower levels of DHEA, for example, the kind of grandmother hormone that our bodies make when people do intermittent fasting in the long term. So eating first thing in the morning is really the most beneficial thing you can do.
I love that. All right. Well, those just some really good nuggets there for us, especially when we're jump starting and kick starting our morning. Thank you for those great pieces of information.
Yes, absolutely.
So there's this new buzzword out there in the fitness and wellness industry, cardiometabolic. So, we know about cardiovascularity. We know about the metabolic rate, but all of a sudden these two words are coming together. What's that about?
So cardiometabolic really is about interrelated risk factors that predispose us to different diseases. So some examples of that are things like insulin resistance, increased abdominal fat, things that put us at higher risk for developing diseases down the road, both related to the heart and to the metabolism in general. So they've kind of combined those words together to help people really focus on not just eating right and exercise, but also the impact of stress reduction on risk of heart disease, the impact of hormonal health on heart disease when we enter menopause for women or andropause for men, very similar. And we have lower levels of testosterone for men and lower levels of estrogen for women. Our heart is most certainly at higher risk because estrogen helps us lower the bad cholesterol, the LDL, and increase the good cholesterol, the HDL. It also helps us maintain the integrity of our vascular system. So our arteries and our veins require normal, adequate levels of estrogen, and testosterone is responsible for the health of the heart muscle in and of itself. So the term is really combining everything together to help people focus on just not what we've always known, diet and exercise, but incorporating blood work, looking at cholesterol numbers, looking at hormones, looking at blood pressure, combining all of those things together to create the most healthy body possible.
So if I came into your clinic as a patient and I needed help in that area, what would be some treatments?
So it's always about gathering the data for me. I don't ever want to guess, and I don't ever want to Band-Aid anything. So I always either ask you to bring in as much of your old blood work as you can, because
Mhm.
everything that you've been through in your life has brought you to this point. And then we
Right.
typically do
Right.
a baseline test, whether that's blood or sometimes a stool test, my least favorite test of my patients to do. They hate to have to do that one, but there's so much information there. Or a dried urine hormone test, sometimes a combination of all of those. We really try to hear where you're coming from and where you are currently, and do what we can to meet you there and help you improve your health from where you are. We don't expect you to go to CrossFit right away, right?
Mhm.
Or even go play pickleball aggressively for hours and hours. We like
Mhm.
to really encourage a slower start, because any stress on the body, whether it's a good stress, a
Yes.
hormetic stress, like ice plunging, right? That's a good thing for a lot of people. But
Mhm.
if they have dysregulated cortisol, for example, if they're under a lot of stress, that what we consider to be a good stress can be too much stress on the body and then put their health at risk. So we want to gather the data, as much of your old information as we can, and then get a good solid baseline.
I see.
So we can see what can we do for you to improve your health today.
I love that. Again, your concept, just meeting the client where they are.
Yep.
That is beautiful.
Thank you.
Yeah. Thank you so much for that information. That is great. Okay. So we saved this section for last, and I know you and I discussed it on the phone a little bit. We wanted to talk a little bit about the silent heart attack. And yes, the word silent heart attack, again, is something that's kind of another sort of buzzword trend out there in our industry. So tell us, what is it? What is a silent heart attack?
Right. So a heart attack, I think most of us in the past have known the signs of a heart attack to be radiating pain down the left arm. But in particular, in women, heart attack can show up in many different ways, in jaw pain, especially neck pain, shortness of breath, unusual fatigue. Any type of symptom that feels off is important to get checked out at the doctor. So I always recommend that my patients monitor their health from a blood work, cholesterol perspective, a blood pressure perspective, a pulse perspective, even an oxygenation perspective. How much sleep are you getting? What does your blood sugar look like? And we have devices that now can monitor all of these different things. There are even devices that you can put on your phone that monitor your heart rate, so you could see how smooth is your heart rate, is an EKG essentially on our phones now. Our phones are so
for sure
literally smart.
Yeah.
But monitoring before that happens is the ideal. But if there are any unusual symptoms related to fatigue or energy or even slight pain somewhere else in the body, if it feels like indigestion, it may not be indigestion, and it's important to get that checked out.
Okay, so with those signs, I mean, a lot of people, especially like that I come in contact here at the JCC, they're coming in, they're doing a group fitness class, they're going to our fitness area to work out with some weights, and or they're going to tennis or swimming. So they may feel a little achy. So I wonder how you can determine if it's just an ache from working out or doing too much, versus that it's something a lot more serious.
So we always recommend that before people start any type of fitness endeavor, that they go to their medical doctor and get examined. And they then will know what their baseline is. So anything that's unusual above and beyond their baseline in terms of fatigue or pain should get checked out. It's much more than just muscle pain in the arms and the legs, but we're talking about any type of unusual pain beyond their baseline pain. And that's why we recommend people take it slowly, because if you jump right into lots of weights, heavy weights and cardiovascular activity, and your body's not used to it, you're going to have some weird symptoms. So moderation is really the key, and starting slowly, building up. And then if there's anything unusual, that's when to seek help.
Yeah. And that's exactly when folks come to the J and they're asking me for a prescription for to get them started with working out, I'm like, slow, small increments.
Yep.
It's okay if you love group classes because there's strength in numbers. So if you're participating in something like that, it's okay if you don't do the full class the first time for the, few first visits that you have, small steps. And I always remind them Rome wasn't built in a day.
Right.
So listen to your body. That's another thing that I think we're really good about, especially like in these large group settings. I'm always telling my students, don't listen to my cues, listen to your body. That's what's first and foremost. So listen to your body and the rest will work out.
And that's a great way to word it. I think we are such a quick fix culture.
Absolutely.
We expect everything right
Absolutely.
away. And we expect, to lose 10 pounds the first month. And, I always encourage people to not get discouraged. That it's a little bit at a time is actually the way to maintain in the long term.
I agree. Yes. Well, do you have anything else that you'd like to share with us that you're thinking of as far as, because it is February, it is heart awareness, if there's some other things that maybe we haven't touched upon that you would like to share with our viewers?
Sure. I think, from a dietary perspective and related to cardiometabolic health, it's important to get plenty of vegetables, lean protein around. Valentine's Day, there are lots of treats floating around. And that's another area I encourage my patients to not get too super restrictive. When I first started in practice, I had a very different view and I was not meeting people where they were exactly. And everybody should, really just be healthy all the time. Well, that's not reality. And if you have a little treat here or there, that's perfectly okay. As long as you get back to your typical routine, minimize alcohol consumption. There really is no research at all that it is supportive for cardiovascular disease.
Not even wine?
So not even
red wine?
I'm sorry. No.
Oh my gosh.
Especially for women, it can be really harmful. And there was some data for a while that it could be beneficial. And there are some things in red wine that are beneficial, but alcohol in and of itself is really, it's a poison to the body and can be harmful over time. Now, the smaller amount, the better, right? If you're going to have a glass of wine, maybe fine. Again, we don't want to be, you have to be 100% all the time.
Right.
And because that's stressful, right? And a big part of cardiovascular health is minimizing stress. So if we're just a little bit more flexible with diet and consuming those types of things, I think people feel a little bit more at peace and a little bit happier about life and not so restricted.
Well, I love that. That's a great way to end this segment. And once again, I really appreciate that you're here today with us to share your knowledge of wealth and wellness with our J community and our viewers. So folks at home, remember when you wake up, it's time to get wealthy and healthy, and we'll see you next time. Thank you.